Hello, everybody, and welcome to this week's edition of It's Worth a Shot. Kyla Newland here up in Alaska, account manager at Mountain Pacific on a very crisp fall day. I see snow outside my window up on the pass, so I hope everybody is ready for wearing sweaters and scarves here as we move into our fall season. A little bit sooner here probably than in the other states. So today we're going to talk about some of the work that we do at Mountain Pacific called Partnership for Community Health. And we have our guest presenters from our analytics department and also from our PCH team in Wyoming. So we'll get started with our updates, our weekly updates, and we can go to the next slide. So just a disclosure here that this presentation may contain information or content supplied by third parties. That's not the case today because we are all Mountain Pacific in-house, but this is for many of our presentations where we do have outside providers presenting for us. And we can go to the next slide. So just a few updates and reminders, some resources. October is Hispanic Heritage Month. So we do have some resources in Spanish. I know a lot of our vaccine resources are available in Spanish, and we can include those when we send out the slides after this call. And then we are working on some videos for flu vaccines specifically that will be in Spanish as well. We have a couple new resources that we just put out for the fall season for flu and other respiratory viruses that are covered by vaccines. So we've got a trick or treat themed vaccine Mythbuster flyer and a football themed. They're kind of fun with some nice little puns on how we should get vaccinated to protect ourselves. And then also, I know that we've had a lot of questions regarding Medicare billing guidance, specifically for COVID-19 vaccines and also for RSV vaccines. So sharing a nice resource that just came out that has some detailed information about that billing process. And please reach out to us if you have questions looking at that document. It still is a little bit complicated. So if you do have additional questions, please reach out to your appropriate account manager. We can go to the next slide. So just an update here, if you folks will remember when we had our fall COVID vaccine approved, they only approved the Pfizer and Moderna versions. And just as of yesterday, we had FDA approval for Novavax vaccine. So we will be seeing that in our fall vaccine roundup as well. And just another note for COVID vaccine access, I was speaking with some of our long-term care pharmacy providers earlier, and there is limited access right now in some of our regions. It's just slowly coming in. Some folks haven't even received it yet. So that is something that we're seeing, and just letting everyone know that you're not alone if you are seeing that in your community. But many of the retail pharmacies do have vaccine, and folks could potentially partner with pharmacies in the Bridge Access Program, which is a program for patients that are uninsured and underinsured to get COVID vaccines. So that might be an option as well, as we're kind of waiting for that to come to our long-term care pharmacies. I think I saw a question.
Yep, there's one. If somebody's getting skilled nursing under Medicare Part A, can you still bill Part B?
I believe the answer is yes, but I am going to refer back to that document, and I can definitely follow up on that question to make it clear.
And I did just post that guide in the chat.
Okay, we can go to the next slide. So we have a polling question here, and as always, please feel free to send us webinar topics that you would like to see, and we do meet every Wednesday. So our question today is, what is your facilities plan for source control with the upcoming flu season? So mandatory for staff, residents, and I'm assuming this is maybe family members. Optional for everyone. Mandatory for just staff and optional for other folks, and not part of the current infection prevention process. Okay, so it's looking like optional for everyone and wavering between just mandatory for staff and optional for other folks. We appreciate you filling out our poll. This helps us direct future educational opportunities and interventions. So it's looking like optional is going to be our top choice here. I think we can go ahead and close that poll, Mary. Thank you. And we can go to the next slide. So this is our COVID hospitalizations, deaths, emergency visits. As you can see, we've got a decrease in 3 of the metrics, and then we are seeing an increase in that trend in deaths, but usually we do see that kind of as a trend as that metric is kind of delayed versus the other indicators. So definitely still seeing COVID. On the next slide, we can see that some of our region is increasing in cases and some of our region is decreasing in cases. Wyoming is kind of decreasing for the most part, except for the northern part. Looks like Montana's got some areas kind of a mixed bag. And then if you look at Alaska, we're decreasing and Hawaii is increasing. We'll go to the next slide. So it's my pleasure to introduce Jennifer Stewart, my colleague and a fellow account manager in Wyoming. She is very passionate for work in our community coalitions and is leading work in Wyoming. And I'm very happy to introduce her today and have her speak about some of the work we're doing.
Thanks, Kyla. We can go to the next slide. I'm going to talk a little bit about our coalitions. Mountain Pacific works with partners throughout a region that encompasses Wyoming, Montana, Alaska, Hawaii, Guam, and the Samoan Islands. Our coalitions work with various partners throughout those areas. They include everything from care partners to long-term care facilities, home health, doctors' offices, stakeholders, community partners that all work together to improve your community's population health. Our coalitions collaborate with those partners to increase communication and resources, along with patient education to improve person-centered care. Go to the next slide. Additionally, our coalitions work towards goals that include things like safer care in hospitals by preventing infections that might be related to healthcare, safer nursing homes for residents by preventing conditions that are related to long-term care, improve the care coordination from one healthcare setting to another by reducing unnecessary hospital admissions or readmissions, improving the well-being of care of people with cardiovascular issues, improving the well-being of care provided to people with diabetes or at risk for diabetes. And there are other areas that we also work on. These are just some of them that we're touching on. You can go to the next slide. Based on the guidance from Centers for Medicaid and Medicare Services, so CMS, data and statistics that we have available, some of the areas that we focus on includes things like care coordination, which may include things like decreasing preventable ED visits or decreasing hospital utilization or hospital readmissions. Patient safety, which could include things like decreasing adverse drug events or decreasing hospital stays, immunizations, which it could include increasing rates of pneumococcal, COVID, influenza, opioid utilization, which includes things like increasing things such as best practices for opioid treatment or pain management, the use of naloxone, opioid medication reconciliation, things like that, chronic disease management, such as things like working with beneficiaries and their care providers to increase hypertension diagnosis, diabetes, decreased diabetes with A1C that's greater than 9.0. We can go on to the next slide. I was going to talk briefly about our state-specific coalitions because we all have specific coalitions within our state. If we can go on to the next slide, please. In Alaska, they currently have 3 active coalitions statewide. They're run by Lori Chikoyak and Kyla Newland. Take Heart, Alaska Care Transitions, and their Elastic statewide opioid coalition. If you want to go to the next slide. In Hawaii and the Pacific Territory coalitions, they're ran by Maggie and Mark in Hawaii, and then Glynis and Aggie in Guam. And there's a various number of them. Maggie and Mark have been doing their coalitions for a really long time. They touch on different things like community health worker navigation programs, advanced care coalition or advanced care planning, provider communications, homelessness, chronic disease. And as a result of their coalitions, they have partners that have improved working relationships and have a better understanding for challenges of all partners that they face, have a contact for a known person on who to follow up with if they have any questions. They reduce duplication of efforts that have been worked on, enable everyone to work smarter and not harder to achieve their common goals. They help to funnel external, regional, and national resources to one group rather than have a siloed communication effort to get helpful tools and resources and guides and education to improve outcomes. I think we can go to the next slide. In Montana, they currently have 7 active coalitions statewide. They're ran by Emily and Ben, Amber, and Cassie. And they are working on things such as focusing on opioids and substance use disorders. Chronic disease and care transitions are currently their primary goals. They're also working on a quality improvement pilot project for hypertension with their PATH team, which is another contract that Mountain Pacific has in that area. They also are working on a social determinants of health plan that focuses on breaking down barriers to better manage chronic disease, along with another project that is in process to work on re-engaging patients into healthcare and chronic disease management through the promotion of annual wellness visits. Their coalition allows community members to have an active role in improving their community's health. We can go to the next slide. In Wyoming, there's currently 8 active coalitions statewide. They're ran by myself and Larissa. We are focusing on areas such as chronic disease management and care coordination, projects such as increasing telehealth providers for diabetes prevention, supporting the library toolbox project that has been created by WICOA and the University of Wyoming, working with local agencies to help decrease opioid misuse, as well as focusing on translating resources into Spanish to better serve all the communities that we work with. Partnerships have been formed within our coalition to help make connections for contact persons to follow up, be able to do follow-up questions when needed, and increasing knowledge of subject matter experts in our community and what resources are available. I think we can go on to the next slide. This is a list of resources that we have available that better lists out in detail what each of our metrics are that we work with, and then who and what each coalition is in each state. They will be listed out where you can get those and on the slides that will be provided later after the presentation so that you can have access to them. We can go to the next one. You can go to the next slide. Maggie, you can go to the next slide. Thanks. Oh, no, there was one that didn't go. Sorry. Go back one. Two. Sorry. Go back one more for me. I don't know why it's not showing up. There should be one in there that lists all of the state account managers and their contact information. There we go. That will also be available to you so that you guys can contact your account manager in your area. That way, if you'd like to join a coalition, if you're not part of one already, you will be able to get in touch with them, or if you have any questions, you'll know who to contact. And then you can go to the next one, Maggie, or Aggie, thank you. There you go. Our participation agreement is a key part for our member participation. It allows us to collaborate with identified interest, and importantly, it lets Mountain Pacific share coalition specific data. The agreement lets us disclose what we're working on with your guys' organization on quality improvement projects, and it also allows the coalition to work with other areas and share data that we have. So it's basically an agreement that lets us share data with you, and you be able to have that data without us. Without that, we struggle to be able to share that data. So if your organization hasn't filled out a participation agreement, we encourage you to do so. The agreement can be found at the link that's on here, and I think that Miranda has been putting that in the chat as well. There's also a PDF version, so if you prefer the PDF version so that you can fill it out by hand or be able to share it with someone else so they can see it, you can simply email the PDF to the account manager that is in your area, and they will make sure they forward it to the correct person. If you want to go to the next slide. Since we just brushed on data and being able to share that, I am going to introduce Liam Hettinger. He is our data scientist that works with us, one of, and he is going to talk a little bit about data and analytics for us.
Thank you. Yeah, so as Jennifer had mentioned, there's some data. That participation agreement can grant you access to some data within the coalition. What I'll talk about is a little bit about the extent of these coalitions' impact on the health outcomes of these communities. There's a couple different metrics that we have that was mentioned in Jennifer's presentation that we're working on in a lot of our community partnerships. And so I'll discuss kind of the extent that the impact that we've made, and then some of the efforts that we've done to collaborate with other individuals within those partnerships for community health, and some of the impact that we have. So you can go to the next slide if you'd like. So one of the metrics that was discussed before was talking about the percentage of Medicare fee-for-service beneficiaries with diabetes whose most recent hemoglobin A1C levels is greater than 9 or not documented. And so the goal of this is we are trying to control hemoglobin A1C levels within our diabetic Medicare fee-for-service beneficiaries. This is throughout our Alaska, Montana, Wyoming, and Hawaii, but we've made about a nearly 11% impact on that, and have increased those fee-for-service Medicare beneficiaries with diabetes, increased 11% of those beneficiaries that have controlled hemoglobin A1C levels. Some of the ways that we've done that is through our coalition work, meeting with local health departments, assisting community partners with quality improvement projects or QI projects you might see throughout this, meeting with local stakeholders to align with goals and promote collaboration, networking events. And as was shown before, those coalitions in each of these states are really kind of the leaders in driving this improvement rate. The collaboration and assistance that Mountain Pacific provides, as well as those coalition members provide, really has made a dramatic impact on this specific metric, but also some more. And so you can go to the next slide there. Another metric that they've made some fabulous impact on is controlling or preventing stage 5 CKD. So what we're focused on with this metric is the percentage of fee-for-service beneficiaries with CKD or chronic kidney disease without stage 5. And so we're trying to really prevent that stage 5 CKD. Some of the work that we've done for this is by assisting community partners in QI projects, and a lot of those have been discussed and expanded on within these coalitions. We've improved this rate by nearly 18%. So it really made a dramatic impact on these states within our region in improving CKD and preventing end-stage renal disease. You can go on to the next slide. Another work that we do is on care coordination and really trying to decrease hospital utilization and readmissions within hospitals. This metric really focuses on the rate of emergency department visits, observation, and inpatient utilization for Medicare fee-for-service beneficiaries. We've improved hospital utilization by nearly 10%. In doing that, we've done a lot of quality initiative projects and assisted in quality initiative projects, as well as collaboration, networking, and providing educational resources to our coalitions through these coalitions meetings. We can definitely be assist our coalition partners by providing extra data resources or just some expertise in certain areas. But really this collaboration is the reason why we've seen such a phenomenal improvement within this category. And then you can go on to the next slide there. Another category that we've seen improvement in is readmissions for fee-for-service beneficiaries within 30 days. So this is something that a lot of our different coalitions have been focusing on recently. And through that coalition work, we've really been able to present different findings and educational resources to our stakeholders, create networking and collaboration between our Mountain Pacific and then also within community members, and then assisting that with data as well. We've seen nearly an 18% increase in readmissions, 30-day readmissions, or increase is the wrong word, improvement in 30-day readmissions within our fee-for-service Medicare beneficiary population in our region. And it really is because of this coalition work and collaboration that we're doing with this coalition work that has driven that improvement rate. And then you can go to the next one. So that I think is all for me, but I'll open up to questions if anybody has any questions.
Thanks. Does anybody want to come off mute and ask any questions of our presenters today? Or do we have any questions in the chat that we want covered?
Miranda, I did put an answer to Maria's question about if somebody is getting skilled nursing Medicare Part A, can they still bill Part B? And I pulled that verbiage right from that billing document. The only exception would be RSV that can only be billed to Medicare Part D.
Okay, thanks for that clarification.
No problem.
Does anybody else on the line have any questions about our PCH work that we do here at Mountain Pacific, or questions of any other topic for that matter we can take a swing at?
Yeah, I would just add, we would love to have you folks involved in our community coalitions because you're a very important part of your communities. So I would encourage you to reach out if you're interested and get more information about what might be going on in your communities related to the PCH work or Partnership for Community Health work that we do.
Looks like Mary popped the evaluation into the chat again. So if anybody wants to fill that out for us, we'd really appreciate it. They do help guide us in the work that we're doing. I believe this webinar was actually number, let me get the right one, 88. So you guys have been with us 88 times for these webinars. So we can't thank you guys enough for coming back week after week and participating in the work that we're trying to share forward.
What is wrong?
Don't think that was for us. Okay, well, it looks like if you don't have any questions or anything else to share, we will give you back some time. We will see you back next Wednesday on October 11th, and we will actually be doing a resource showcase that's from Mountain Pacific. So a lot of the new resources.
Miranda, sorry to interrupt. There was
Oh, go ahead.
somebody that said something about it costing money. I'm trying to. It should not cost money to be involved in our coalition, Jessica. Do you, if you reach out to one of us, we can help you get hooked up with whatever area you're in and get going with whatever coalition you would be involved with, but it does not cost money to join.
Thanks for catching that, Jennifer.
Sorry to interrupt, Miranda.
Nope, not a problem. Yes, please do
What
reach
state
out.
are you, what state are you in, Jessica? And we can connect you. Hawaii, okay. All right, I will connect you with Maggie.
Thanks, Kyla.
Mm-hmm.
Great. Okay. So then we'll call it quits a couple minutes early. Again, next week, next Wednesday, we hope to see you, and we'll be showcasing some resources that Mountain Pacific nursing home team has come up with. So hope to see you guys all next week. Thank you.
Bye, everybody.